So good morning, my dear brothers. Welcome back to our biomedical ethical class. Let us have a quick look of what we had learned yesterday. We had learned so many things, but there was no PowerPoint, and it's good that we just have a quick look. Okay, let us have a quick look at what we have learned. We began yesterday with our ethics. The term ethics. What does the ethics mean? There are many definitions by WHO, Oxford Dictionary, Merriam-Webster, so many definitions we spoke about. Finally, we said, in short, ethics is a set of philosophical beliefs and practices concerned with the distinction between what is right and what is wrong. Okay? And we also spoke about medical ethics and made a difference between what is normal, simple ethics and what is medical ethics. Medical ethics is the branch of ethics that which deals with moral issues, the medical practice, the medical research, the medicine, the area of medicine. Also, it is related to bioethics, but it is not same. Medical ethics, although it is partially related to biomedical ethics or bioethics, medical ethics is not equal to bioethics or biomedical ethics. And we spoke about a few definitions like Warren Thomas Rich is the author of Bioethics Encyclopedia. What he says is bioethics as a systematic study of human behavior, human conduct in the area of life science and healthcare, insofar as this conduct is examined in light of moral issues, moral values and moral principles. Okay, that is what the famous author of bioethics, Warren Thomas, says. Again, we also spoke about the definition of Cardinal, ex-president of Pontifical Academy for Life in Vatican, is Cardinal Elio Sagrezia. He says that the study of the typically controversial ethical issues emerging from new situations and possibilities brought about by the advances in the sciences today that we have in biology and in medicine. Also, he says bioethics is the moral discernment because it relates to the medical policy and practices that we are doing today. Also, he continues, bioethicists are concerned with the ethical questions that arise in the relationship among life science, biotechnology, medicine, politics, law, philosophy, etc. And finally, we also learned about the definition of Daniel Kayan, this American philosopher. He says that bioethics came to refer to the broad terrain of the moral problems of the life science. It is taken to encompass medicine, again biology, science, and other areas like environmental, population, and social science, etc. Then we began with the historical background, so-called the ethical course, starting from 5th century. It starts with the Hippocratic Oath. He's a philosopher. Also, he is known as he's a father of medicine. The Hippocratic Oath is an oath traditionally taken by physicians pertaining to the ethical practice of medicine. It is widely believed that the oath was written by Hippocrates, a philosopher who is considered as the father of medicine. Okay, the 4th to 5th century. Or one of his students. Again, this is oath. When you come closer and read, you understand the statements that we read yesterday. I solemnly take this oath on this day and follow the patient's his rights, his respect, his dignity, patient as yet. As a human being, how he takes the time of taking the profession, the oath. Also, pardon? I'm not getting it.
The oath should be.
Then again, we also spoke about the Nuremberg Code. Nuremberg is one of the largest city in Germany. Nuremberg Code in the year 1948. As I said, these are the laws were brought into judge by the American judges. They said the Nazi camp, they misused so many slaves or the prisoners who were in the concentration camp. They made an experiment on human beings without proper code, without proper guidelines, without their consent. The patients, or so-called the slaves, were in the Nazi camps. So they were brought to trials by American judges. They are actually in the court. The court, and there are cases going on. Also, we said about the Declaration of Geneva in the same year, 1948. And there are so many promises that they made during the profession. Like we said yesterday, I solemnly pledge to dedicate my life to the service of whole humanity. The health and well-being of my patient will be my first consideration. It will be the first importance in my duty. Again, he said that I will respect the autonomy, the freedom, the choice of the patient, and the dignity of my patient. That is what so many codes and statements. It came into origin in the year 48, the Declaration of Geneva, which took place in Switzerland. Again, we also dealt with the Universal Declaration of Human Rights, the same year 48. And finally, we concluded with the Indian Medical Council. Again, here also was the agreement with other medical councils, like I solemnly pledge myself to consecrate, to give up my life for the good of my patients, my clients who come to get treatment from me. I also maintain the utmost respect for human life from the beginning of the conception, from the womb. I try to respect and give each one his due, his respect and dignity. The health of my patient will be my first consideration, as I said earlier. I also will maintain by all means in my power the honor and noble traditions of the medical profession. Whatever the medical profession has taught to me, I shall abide, I shall stick to the code of my profession. Also, I shall abide by the code of medical ethics as enunciated in the Indian Medical Act 2002. This is what we have seen in last class. Now today, let us deal with 4 basic principles of medical ethics. 4 basic principles of medical ethics. Which are they? Autonomy, beneficence, non-beneficence, and justice. These are the 4 basic principles of our medical ethics. In short, autonomy would say, patient right to decide on the treatment. Patient has got the right to decide to go for treatment or not to go, to take the medicine, not to take. No doctor can compel, force the patient to take that particular medicine or to take that particular treatment. Your autonomy means the patient's freedom, the willpower to choose whether to go for the treatment or not to go. We'll deal with one by one. The principle respect of autonomy. The word autonomy would mean to say independence or freedom. The patients have got the independence and freedom whether to accept the treatment from his doctor or from the doctor, or to reject for no reasons, because we have to ask why you want to reject. No, it is upon fully his free will and his choice. Nobody can force your patient, when they come to treatment, can force them to take that particular medicine or particular treatment or a particular surgery. They want them to take whatever doctor has got the duty to explain the gravity of the sickness or what medicine is supposed to take, but then it all depends on the patient. If he wants, he can take, or he can simply reject the prescription. The patient has got the freedom and choice to make, whereas of the free will of his own actions. The principle of autonomy is also called the principle of human dignity, and it involves obligation to show respect towards the autonomy of other people. As per this principle, competent adults have the right to make informed decisions about their own health interventions. Okay? This principle of autonomy, which also says that the adult patient to take decisions regarding his or her health care. You are already above 18, you are adult, you are mature. You are mature enough to make a proper decision whether to go far or not to go far. You have the freedom, but at the same time, you are also responsible for your body, your disease that is there in your body. Whether to go for the treatment or to avoid and destroy your body with the sickness that you have. Patients have the right to refuse treatment. They have the right to, as I said, they have the right to refuse the treatment. No physicians have got the right or to compel or obligate the patients to take the treatments that physicians desire. Sometimes the doctors, when you go for a medical checkup or the consultation, they compel you. You have to take this medicine for this many days, or you have to make a visit after 14 days or every month. You should come and consult me. They want to see how far is the progress, the medicine working in your body, or how far the sickness, the treatment is getting better. Sickness is getting better or worse. So they ask you to come every month, that depends on the gravity. Sometimes it is the freedom of the patients. It could be because of they're economically poor, they can't make every month visit and go for new medicine, new doctor. No. Or even if they have money, also they can simply avoid the particular hospital or particular treatment. It all depends on the patients, those who want to go. But in no situations the physicians can compel or oblige the patients to come for the treatment or take medicine. They may suggest, this is the situation of your body, you have to undergo such. Still then, it is a call of the patients that to make a regular visit, to take the tablet, to take the treatment, or no, they can simply deny for no reason. It is a principle of autonomy. Again, the patients have the right to refuse to take part in medical research. For example, we have a post-mortem or autopsy, an examination of the dead body to determine the cause of death. Sometimes we can simply deny ourselves, unless it is involved in the civil case. They have to go for post-mortem. Otherwise, you have no right to exercise or practice or do some research or do any post-mortem of any individual unless it is involved, for example, in case of suicide or murder. Sure, the police comes and enquires you and takes you to the hospital, government hospital, not private. Should they take to the government hospital for the post-mortem to find out the cause of death, how he died, although they put to the rope and hang it, but then somebody also might have killed by force. There will be some internal symptoms inside. The only doctors during the post-mortem could reveal exactly how the death, how the cause of death of the individual. Okay. The healthcare provider should provide relevant information, but should not try to influence the patient's decision. The decision should be made out of free will and voluntary. Okay. As I said earlier, the physician should give the whole information about the patient's sickness and what kind of issues undergoing in his body, what kind of symptoms and problems that the patient is undergoing. He can give the whole information. You can say, this is a problem you have, you may be going to die in another few months, few years, but then you cannot, the decision should be made ultimately by the patient, not by the doctor to take any treatment. Okay, that is what the principle of autonomy says. Again, the autonomy is the basis for the concept of informed consent. The term informed consent is very important here. Now, what is informed consent? The dictionary definition of the consent is to give permission for something to happen. So the patient gives his permission for the doctor to act upon him. It could be a surgery, it could be a treatment, it could be checking of the human body, and to agree to do something. The process by which a patient learns about and understands the purpose, benefits, and potential risk of the medical or surgical intervention, including any trials, and then agrees to receive the treatment or participate in the trial. Informed consent generally requires the patient or responsible party to sign a statement confirming that they understand the risk and the benefits of the procedure or treatment. Get me what I want to say? So before undertaking any major treatment, major operation or surgical issues on the body, it could be a heart surgery, it could be liver or kidney, anything. The patient should get all the information from the doctor, what he is going to do, in the operation, what he is going to do, and he has to make the final decision. Who? The patient. The patient is major, because he is supposed to take. The patient is minor, parents or the guardian. In the case of mentally disordered, mentally differently able people, who will make? There are people, mentally retarded or differently able people. They are not aware of it. They don't even they are in the hospital. They don't know even they are with the doctor. In this case, the guardian or relatives are one who is taking care. Ultimately, they have to give their consent, having learned all the information, all the details about the treatment, the cost, who is going to operate, how many days it will take, that he has to be in the hospital, and the expense, everything. After having received all the information, the guardian or one who is taking care of this differently able person supposed to give the final agreement and the sign in the statement. Then only the physicians of the hospital would consider your case for the treatment. Okay. The patient must be adequately informed about the benefits and risk of the proposed surgical treatment. Not only the benefit. There are surgeries, treatment which will have some side effect. Not be immediately, but in the course of time, years later, will have some side effects. So the physician is supposed to inform both the benefits of the treatment, also the side effect that will. There are some surgeries and treatment. By all means, your body is so weak and your organs are not functioning that healthy. You will have some side effects, not immediately, maybe in the future. So the doctor has got the duty and responsibility to tell his client, his patient, when he comes for such operation, supposed to say both benefit, also the risk. So risk that is going to happen in the future. The patient has the right to decide whether or not to accept the treatment. Once again, the patient is the one who makes the ultimate decision, in the case of major. A competent patient has the right to refuse the treatment after adequate information, even when this refusal would lead to his or her death. Now what happens? There are patients, when they approach doctors, when they consult, they get the information, about the health issues and the treatment. Suppose the doctor says, if you are not operated of this, you are going to die, lose your life, or your lifespan may be reduced. So even in such cases, the patient can make a final decision, judgment, when he can simply refuse the treatment. Though if he doesn't take treatment, he may be going to die in a few months or few years. However, still, the patient has the right, and he can make a choice. So see the power and rights and that he can exercise. The patients. I don't know if we have that system here in India. Sometimes the doctors will speak and convince you so much. You are simply taken up and you have to go for the operation. Sure, you have to pay. I have seen many of my friends, when they go and approach one hospital, one doctor, for simple thing they would suggest they could go and have a surgery. The treatment could be over with one pill, one tablet for a week, but then they would advise you to go for surgery, which means you have to pay. Surgeries are costly. Surgeries are costly. It's government hospital, otherwise you have to pay. Always. So even simple cases, they would ask you to go for surgery, so that you have to pay to the hospital, and they are properly making business. There are also hospitals and doctors. I have heard from my companions and patients, when they want to undergo some sort of surgery, maybe a knee surgery or a back, they say it could be easily healed up, Ayurvedic or homeopathic. Go to different places of India, get good oil therapy, oil massage, and it could be healed. Any injury, internal injury on the knee, on the elbow, on the back, or neck. There are people who do not operate, but rather they take this kind of home therapy or natural medicines, which is very cheap. It's not very costly compared to English medicine. It is very cheap, so they are advised on it. So there are both cases. Both cases. People who keep on doing surgeries after surgeries. Abroad just become very famous that they are so much concerned about their beauty and their skin. They go on making plastic surgery on the face. Michael Jackson, how many surgeries here? made. If you go through the internet, you will know how many surgeries that he underwent. There are many VIP and rich people. They are so much mad after or concerned about their body. They keep on operating, keep on doing surgeries and treatment so that they could remain ever young and fresh. There are many what we call you don't say exactly Indian actresses. There are good many. They don't want to get married. You get married, sure. Without children, surely you become your body will become old and even you are not eligible to act no more in the market. Film industry of marketing. Okay, so they are afraid to get married. To have children. They have children surely. They have to concentrate on the family and the children. They have no time for acting surely. They are that strong or that beauty after their marriage comes down. So many they avoid. They give importance to their business and personal life than the married and having children. Okay. Patients have the right to exercise choice over their surgical care and should be allowed to refuse treatments that they do not want, even when surgeons think that they are wrong. Sometimes I am suggesting you an operation, a treatment, and you don't understand fully, and you say no. Again, I am telling you, no, this is not the way. No, there are risks in your life. By all means, you have to undergo. But still, then you are not understanding properly. You are worried about the money. You are worried about the hospital. Your own, risk of losing life. Still you can simply deny, reject the physician's word, and you can simply reject any sort of treatment. Although it is a danger to you. If you don't do it, it's a danger to your life. But still, you can deny because it's your right. It's your body, and you have the freedom and choice to make whether to go for treatment or not to go for treatment. So that is with regard to the principle of autonomy, respect for autonomy. Okay, clear? Good. Now, second principle, the principle of beneficence. Principle of beneficence. The surgeon should act in the best interest of the patient. The procedure be provided with the intent of doing good to the patient. Always doing good to the patient who comes to you. The doctor is called to perform always the best he can. Not simply I will try. No, always should give the best whatever he learned in his college, in his career. So he is asked to perform the best that he can when the patients are in the hospital. One should do minimum harm to the patient, including the painkiller or pain control. But when in the case of want to give you a painkiller, that should cause you a greater evil. It should be in quantity and quality. You should always, the physician should control not to harm the patient by giving, although the painkiller, what you call it, reduces pain, but it will have its side effect. It will have its side effect. You can't take, for example, sleeping pills. You may take one, but when you take more, you will be sleeping long, 8, 9, 10 hours more than the normal, or even sleeping pills can take away your life. So the doctor is asked to do minimum amount. There are some cases, some surgeries, we have to by all means, the pain and suffering the patient has to undergo. However, the surgeon or the physician is asked to do only the minimum evil, even the situations when he can't avoid. Okay. This principle states that the goal of any treatment should be to provide benefit to the patient. Okay, always do good and benefit the patient. Right? When a treatment has both benefit and harm, the doctor has a duty to weigh the harm and administer it only if the potential benefit for the particular patient is likely to be greater than potential harm. He has to consider before going any treatment. The physician has to see, which has got greater. When you do this operation, you have more benefit or less benefit, or more evil or lesser evil. If there is more benefit, surely you could go for the treatment of the so-called surgery. But while doing surgery or even after surgery, there is more harm to the body, to the individual, better to avoid that sort of surgeries or that sort of treatment to the patients. Beneficence is do good and minimize any harm. Always do good and minimize any harm. And third one is non-maleficence. This is based on the principle of the first. do no harm. Okay? Do no harm to your patient, clients. In Latin it is said primum non nocere. Primum non nocere. When I give you notes, it will be clear. First, do no harm to your patients. Above all, do no harm. Make sure that the procedures does not harm the patient or others in the society. Okay? Great surgeon and writer Richard Zelzer has written of the fellowship of knife. You know the term fellowship of knife. You have read the fellowship of the meal, fellowship at the table, but he says these are the fellowship of knife, to which all surgeons belong. A knife can remove your life and put in danger by harming and by cutting you into pieces. There are a lot of killings taking place in society. The knife, they pierce you, your body, cut your throat. A knife can take away, remove your life, by cutting you. Also, the same knife should save you in the medical treatment in the hospital. The surgery, imagine, the shot, the bullet is there. They want to operate without using knife. The surgeon cannot operate. You say, no, let the bullet be there, please don't use knife, use some other method. Now, which method to use? So the same knife again is being used at the what you call it, in the operation theatre to remove the bullet from your body. Knife is one, but then it's got a good and bad, two things. It depends on how you use it. The healthcare provider should avoid causing harm either by acts of commission. Now, what is acts of commission? Providing a wrong or unnecessary treatment. It's acts of commission. Or the act of omission. Omission is not providing the right or necessary treatment. Understand the difference between act of commission and act of omission. Act of commission, that which you are supposed to give, but no, you are giving a wrong, unnecessary treatment. Patient doesn't deserve that treatment, but you are giving just for the sake of getting money. Just for the sake of getting money. The patient sometimes doesn't deserve. Sometimes when mothers are pregnant at the 9 months when they want to deliver, it could be a natural delivery, normal delivery. But then the hospitals will make you cesareans. For it is true in India, many of these days it's very hard to find a natural, what you call normal delivery. Always, they make, when you go to hospital, sure that they make sure that you go for cesarean. It's very costly. Depends on each hospital, starting from 50, 70, 80,000. Depends on the hospital. The hospital is good, standard, they have the good name and fame. The society, go to city hospital, it's about 1 lakh. They say, child is in a complicated position, and we have to follow so many methods and procedures. And the amount will be this. Surely, you need to save your wife and your children. So, no amount for you, you'll be able to spend there and they get the child and the mother safe. Yes or no? So, depends sometimes. The physicians, the hospital, they make a business and they make sure that you pay. You pay at the hospital.